right, so next it's my pleasure to bring back my dear friend Chris Iobst. As we know, he's the director of Center for Limb Lengthening and Reconstruction at Nationwide Children's Hospital at Columbus, Ohio. He's the fellowship director. He runs a fellowship on limb reconstruction down there. He's a very prolific researcher and educator, and as we mentioned earlier, a champion of physician burnout prevention. So Chris is going to tell us about lessons learned in limb reconstruction. Thanks, Chris.
Thanks. It's a real honor to be here. I've really learned a lot from the distinguished faculty today, so thank you for including me. And I know Caitlin's gonna.
Well, that's right. Yeah.
So thanks again. I'm going to share with you some lessons learned in limb reconstruction. I can't possibly fit all of them into 9 minutes, but we'll try to cover as many as we can. Here are my disclosures. Let's start with some good practice habits to develop when you're just starting your limb reconstruction practice. There are so many details to keep track of in any particular patient actively undergoing lengthening or deformity correction that I recommend you see them every week in the office. It will allow you to closely monitor their progress and catch any possible complications early, or even prevent them before they happen. Longer periods of time in between visits increases the chances of something going wrong. In addition, since you are trying to build up experience and management skills, the weekly visits give you more learning opportunities. Even a mundane routine visit can teach you something. Many of us tend to be people pleasers, and we want our patients to like us. But as the physician, you need to have boundaries and stay firm. Don't let a patient talk you into a surgery that you don't think is appropriate. For example, if a patient begs you to do both legs at the same time, but you know that it will compromise the outcome, don't cave in to patient demands just to be nice. Complications are inevitable, and you need to be aggressive when you identify one. Don't ignore it, hoping it will get better, because it won't. You need to embrace them. You need to treat them as learning opportunities and not an indictment of your skills. Discuss the complication with colleagues and formulate a plan as quickly as possible. Being upfront, honest, and transparent with your patients is always the best policy. If you acknowledge the issue and offer strategies for correcting the problem, the patients will feel more comfortable and they will almost universally maintain their trust in you. Coordinating a team with multiple members and moving parts is difficult. The only way to stay on the same page is to have clear and constant communication. We have a core team huddle or powwow before clinic to go over the plan for the day and to get everyone in the right frame of mind for working at our best. We have a core team huddle after each clinic to go over the plan for each patient, make a to-do list, and review any previous to-do items. It allows a consistent team message to be delivered to the families. Whether you want to face it or not, most of the surgeries we do are unpleasant from the patient perspective. I've never had a patient tell me they enjoyed having the fixator on so much that they wanted me to put it back on again. Therefore, with that concept in mind, you need to strive to make every part of their care journey as comfortable and respectful as possible. Keep your clinic running on time. No one enjoys waiting for the doctor for 2 hours. Remember, some patients have traveled a long way to see you, so give them your time without trying to rush out of the room. Before you enter a room, take a few deep breaths and clear your mind so that you can present the best version of yourself. Make it a team policy to respond to patient messages and provide lab and advanced imaging results as quickly as possible. Nobody likes waiting on pins and needles to find out a result. Just remember, it's important to treat them how they would want to be treated, not treat them how you would want to be treated. Let's talk about ways to improve your surgical skill. By labeling it a skill, this implies that, like any other skill, the more you practice and invest time in it, the better you will become. There are many components to becoming a skilled surgeon, but increasing your efficiency is sometimes underappreciated, but it's something that everyone can learn, and it pays huge dividends. So let's talk about ways to improve your efficiency. One way is to keep a surgical journal. After every case, spend 5 minutes or so reviewing the case in your mind. Write down things that went well and things that went wrong. Give yourself a grade. This journal then becomes a living document that you can refer back to and review notes before you do the same case again and refresh your memory about the details. Nothing is worse than finding yourself in a jam that you've been in before because you forgot to avoid something or you forgot the solution that you used the first time. Your notes will get iteratively better until you have evolved that particular procedure to its most efficient state. This is especially helpful for cases that you do only once in a while. For example, lip distraction is a case that I only do every few months in my practice. Therefore, I take notes regarding how to properly position the limb, the order of pin insertion that I use, and I take photographs to remind myself how to build the constructs. I can then refer to this each time before I do the case, and it helps it go more smoothly. Another huge boost to efficiency is to visualize the surgery beforehand. Professional athletes often do visualization, and it's been shown to improve their performance. Spend time thinking about the entire surgical scenario. Make a problem list. Think about patient positioning, anesthetic needs, equipment needs, etc. Write out every single step of the surgery so you've forced yourself to consider each detail. And make sure you do this several days ahead of time, not the morning of surgery. This gives you time to review it multiple times and potentially act on any issues that you have uncovered by writing out your plans beforehand. Then bring these plans to the operating room with all the pertinent radiographs and cross-sectional anatomy images. I post these where everyone can see them, and it allows the entire surgical team, as well as the X-ray technician, to know the plan. They can then follow the plan along with you and anticipate your next step. This method enhances the communication among the team and will improve your efficiency and give you a higher chance for a successful outcome. As an example of the power of this pre-planning, it will allow you to distill this complicated back table with multiple trays and pieces of equipment down to the bare essentials. Everything I need to complete my case is right here on the Mayo stand. There's no wasted time or energy going back and forth to the trays looking for parts or pieces. I'd like to take the last few moments to go over a couple of pearls. There is no reason for you to go through this journey alone. You don't need to attempt to blaze a new trail. Find a mentor or mentors that can help guide you. They will steer you in the right direction and help to avoid mistakes that have already been made in the past by others. More importantly, finding a mentor will stimulate conversation and connection. There's nothing more debilitating and dangerous than feelings of social and/or professional isolation. It is one of the strongest risk factors for suicidal ideation. Have the courage to reach out to a trusted colleague when you need help. It could save your life. It's extremely important to establish clear and realistic expectations with your patients about what the postoperative course should resemble and what the outcomes of the surgery can and cannot do. Listen to what they're asking or expecting and steer them towards reality if they're veering off course. Make sure you're on the same page before you agree to do anything. These are complicated surgeries, and it may take multiple explanations to help your patient and their families understand what it is about to happen to them. Don't ever sign up someone for surgery the first time you meet them. Have them demonstrate their reliability and desire by having them return to clinic multiple times. There's nothing worse than starting a long limb reconstruction postoperative journey with a patient who is unhappy or unpleasantly surprised by the way the surgery turned out. Being a member of the field of limb reconstruction can be rewarding and gratifying, but it also can be stressful, demanding, and full of disappointments. You need to have an honest evaluation of yourself before choosing this field. Are you mentally, physically, and emotionally able to handle this kind of work? Think long and hard before you commit to a lifelong practice in limb reconstruction. Finally, in a world where instant gratification is expected, building a limb reconstruction program takes tremendous patience. Unless you're in the rare situation to join an existing pediatric limb reconstruction practice, it will take years to build up a steady stream of cases, and it requires continuous effort to maintain the case referrals. While you may have to supplement your practice with other types of cases in the beginning, don't become frustrated or lose faith in your decision. A career in pediatric limb reconstruction surgery is an extremely rewarding and intellectually stimulating experience that is worth navigating the difficulties that exist when first getting started. Thank you for your attention. I'll be happy to answer any questions either by my email address or during the discussion section of this course.